Ladies and gentlemen, good day to all of you. It is an honor to be with you, and thank you for this opportunity to speak to you about a disease that affects all of us. Dementia causes so much suffering to the patients themselves, to their partners, friends, children, grandchildren. Dementia affects society as a whole. In 2040, dementia will be the main cause of death and the most expensive disease in the Netherlands. The burden on our healthcare system and on our healthcare workers is and will be huge. We are not alone in this. 50 million people suffer from dementia worldwide, and our number will triple in the next decades, including in China. I understand that in China the number of people with dementia is expected to reach more than 20 million in 2030 and almost 30 million in 2050. So, it is clear, when all of us are affected, we all need to face the challenges ahead jointly. And for this reason, joint coordination is of the utmost importance. In the Netherlands, we developed the National Dementia Strategy that runs from 2021 to 2030. And I appreciate that my health counselor at the Embassy of the Netherlands in Beijing took the initiative to have our National Dementia Strategy translated into Chinese last year. And thanks to this concrete action, we are more able to further engage with Chinese partners across the entire value chain, from fundamental research to business. You also find the Chinese version of our dementia strategy on the JAIN website. Back to our national dementia strategy. Its ultimate goal is to find a cure for dementia through international cooperation. However, for the time being, we have to accept that dementia cases are increasing. And in the meantime, we are determined to enhance the quality of life of patients with dementia. How are we doing this? Through support and care that meets the preferences or needs of people with dementia, of their families and caregivers, by enabling them to participate in our society for as long as possible. In short, we are focusing on helping them make the most of their abilities instead of focusing only on compensating for disabilities. We strongly believe that people with dementia are valued members of society. Ensuring their full inclusion in all dimensions of public life is everyone's responsibility. And to realize this, I am convinced that we should introduce more technology in our support and care system. With regard to technological innovation, in the Netherlands we have been developing different technologies in line with the 4 stages of dementia: mild cognitive impairment, early stage dementia, middle stage dementia, and late-stage dementia. Various of these technologies are being developed in the context of so-called public-private partnerships. When organizing care for people with dementia, one may not immediately think of technology. Yet, many smart technological developments can indeed help patients, help their family and social environment, and even their healthcare workers. This does not mean that technology can replace the human factor in care. Rather, it enables the patient to live more independently while still living in a safe environment. And this environment isn't necessarily the nursing home. With the help of technology, we can train people to make better use of their abilities, thus delaying or even avoiding the need for nursing home care. Such an approach will help the patients with dementia to remain part of society. And clearly we are in great need of smart solutions. For instance, smart solutions making use of artificial intelligence. Even small technological innovations can make a big difference in terms of safety and freedom in and around the home. Current examples are most encouraging, such as a smartwatch that can track location and prevent a person with dementia from getting lost, or think of a smart camera that works with a face recognition for a patient who doesn't always recognize his or her family member and feels afraid to answer the door. Whenever the doorbell rings, the camera will tell the patient who is in front of the door and if it is safe to answer. The key added value of such technological innovations is that they can reduce fear and anxiety and enhance the autonomy of persons with dementia. Another example is a social robot that helps with the daily routine by reminding them to take their medication or letting them know that a visitor will arrive soon. So I believe that we should embrace technology and artificial intelligence for the future of dementia care. We all know that technology cannot replace loving care. But if patients and healthcare workers have access to and make good use of technology, there will be more time for other types of care. This is why the work of JAIN matters. JAIN is working on AI solutions, not only for but also together with both patients and caretakers. And they are working on an international scale, which will make these solutions more affordable. The network is driven by a people-centered purpose to bring more joy, meaning and autonomy in the lives of patients with dementia, to lessen the burden on their loved ones and their caretakers, and, in the end, to make the whole of society a better place. Ambitious goals require ambitious funding. That is why the government of the Netherlands will host an international high-level conference on dementia next year. The aim of this conference is threefold. First, to generate and boost interest in the challenges dementia poses to post-COVID societies. Second, to create a space for worldwide coalitions and formulate concrete actions on improvement of care and support. And third, to promote investment in research in this area. The ultimate goal of the conference is to defeat dementia through these three concrete actions. We aim to conclude the conference with a ministerial declaration confirming the actions and its timeline. My health counselor, Mr. Nico Schietekatте, will be able to provide you with more details on this conference in due course. I would like to conclude by thanking the organizers for providing me with this opportunity to share some highlights of both my national and international ambitions in dealing with dementia and the role that technology can play in this area. From my previous job as a CEO of an elderly care organization, I have visited China and got inspired by what I saw there. As a Minister for Long-Term Care, I am happy to see that our bilateral cooperation with China in the field of dementia is being both widened and deepened. This JAIN-China summit fits therefore very well in our longer-term engagement with China on this topic. I look forward to visiting China again, accompanied by a delegation of researchers and entrepreneurs, this time as a minister. I also look forward to receiving delegations from China in the Netherlands. Let us then together take the next steps in co-designing, co-creating, co-developing and scaling up common solutions to our shared challenge. International cooperation will make these solutions more accessible to our people with dementia and ultimately to cure dementia altogether. Thank you very much for your attention.